Hi, this is Dr. Brandon Erickson. I wanted to talk to you today a little bit about reverse shoulder replacement surgery and answer some common questions that people have oftentimes before surgery. Now, a reverse shoulder replacement is actually something where we switch where the ball and the socket are in the shoulder. And the reason we do that is because you don't have a functioning rotator cuff or you have a lot of deformity to the shoulder. And when we do a reverse shoulder replacement rather than a standard shoulder replacement, you don't need to have a functioning rotator cuff for that shoulder to work well out from surgery. So if you don't have a functioning rotator cuff, we can't do a standard shoulder replacement because your shoulder will not function well afterwards. Rather, we do this reverse shoulder replacement because it changes the mechanics of your shoulder and allows your deltoid muscle, which is the big muscle out here, to power your shoulder. So it's a very good option in people whose rotator cuff is not functioning. Now, the reverse shoulder replacement surgery we do through a skin incision in the front of the shoulder here, where we split both the deltoid and the pectoralis major. There's a little plane between there, so we don't actually have to cut any of that muscle, and we get down to the shoulder. Now, to get access to the shoulder, we peel off one of the rotator cuff muscles in the front, then we have access to the shoulder. So we get rid of the arthritis, we put our implants in, and then we close that rotator cuff tendon on our way out. And we want to let that heal in for the first 6 weeks out from surgery. So we protect you from doing some certain motions after surgery. Now, the surgery itself takes about an hour and a half to do, and usually we do it as an outpatient procedure. Some patients will stay in the hospital overnight, but most people go home the same day. And when you wake up from surgery, you're going to be in a sling. The sling is going to stay on for about 6 weeks. Now, you can come out of the sling to bend and straighten your elbow, type, write, feed yourself, things like that, totally fine. I just don't want you lifting the shoulder away from the body for the first few weeks. So I want to let that rotator cuff tendon heal back in where I put it back in place so that we can give you the best functioning shoulder possible. Now, as I mentioned, you'll be in the sling for about 6 weeks, and then we'll start some physical therapy. And the physical therapist is going to work on getting your range of motion back and then work on your strength. And you'll be in therapy for somewhere around 3 to 4 months, depending on how you progress, with the goal of getting you back to pretty much all the activities you like to do by 5 or 6 months out from the surgery. Now, there's a few things I want to tell you about as far as the postoperative course goes. You're going to have a nerve block that's going to help with your pain. But that's going to wear off about 8 to 10 hours out from surgery. So you're going to go home with an anti-inflammatory medicine, some Tylenol, as well as a pain medicine. I want you to take the anti-inflammatory medicine and the Tylenol scheduled for the first few days. The pain medicine you only take if you need it. Some other things that can help with the pain are when you're sleeping, I want you to sleep either in a recliner or propped up on a few pillows behind you, because oftentimes sleeping flat can hurt after shoulder surgery. The other thing that's very effective in helping with pain is to put a big bag of ice over the shoulder or to use an ice machine over that area, not when you're sleeping, but when you're awake, to help with some of the swelling and pain in the shoulder. This can be actually very effective. Now, before surgery, there's also some things that I have you do. I have you get a CAT scan, a CT scan before surgery. And that's very important because what I do is I look at that to check your bony anatomy, and I actually upload it into a planning software that you can see here, where it allows me to actually plan your surgery out before we do the case. You can see here, this patient, we planned out the size of the implants and where the implants should go so that we make sure that at the time of surgery, put the implants in the exact right spot and size the implants exactly correct to your particular bony anatomy. So it's very important that you get the CT scan done at least a week before surgery so that we can upload the plan into the software and I can then plan the surgery. It's almost like doing your surgery twice, and so it makes sure we do it right. The other thing that I have you do before surgery is I have you go to the drugstore and get some benzoyl peroxide wipes, and I have you wipe the area where we're going to do the surgery. And this is to decrease the amount of bacteria that live on the skin in that area. One of the problems we see after shoulder surgery, although it's not common, is that a skin bacteria that lives on the skin can sometimes cause an infection after the surgery. And we know that if we use these benzoyl peroxide wipes for about 3 days before the surgery, up to the date of surgery, it'll actually decrease the amount of this bacteria in the shoulder and decrease the risk of you having an infection. Now, again, we want to get you back to doing most of your activities by about 5 to 6 months after surgery. And especially from a golfer's perspective, we usually have you chipping and putting around 4.5 months, and then we start to progress you up to irons and a driver by 5 or 6 months that you get back to playing golf. These are just some of the common questions that we get either before or after reverse shoulder replacement surgery. Now, certainly myself and my physician's assistant are always available if you have any questions, but hopefully this will help answer some of the common questions that you might have. Have a nice day.